It is time to reimagine leadership. My name is Ben Oden, and I would like to welcome you to a series of conversations in partnership with WomenLift Health around how can we develop new approaches to the new challenges that leaders face in the 21st century. Greetings to you. I hope you are doing well and are having a wonderful and productive and meaningful day. Welcome to another episode of the Why Lead podcast. I'm your host, Ben Oden. Now, we're having a series of conversations in partnership with WomenLift Health as part of the conversations around reimagining leadership, right? These days, there are so many new challenges, and those new challenges require new approaches. And in our conversation today, we will be exploring how we can use visionary and transformative leadership to navigate uncharted and complex territories in leadership in the health space and beyond. And to have this conversation, I am joined by a former UNICEF representative in India, where she served for 4.5 years, leading UNICEF's program, including supporting the response to the tragic consequences of COVID-19 pandemic and spearheading innovative initiatives to support and engage children and young people. Prior to this, she was the Deputy Director of UNICEF's Office of Emergency Operations, where she played a leading role in the programming and policies for an effective UNICEF response for children in humanitarian crisis. Dr. Haque served as served as the first UNICEF representative in South Sudan and UNICEF representative in Ghana. As Deputy Representative in Sri Lanka, where she was responsible for guiding and coordinating UNICEF program of support as well as emergency response to the 2004 Asian tsunami. Dr. Yasmin Ali Haque, karibu.
Asante sana.
Now, you have worked in many different contexts. Mm-hmm. You've worked in many different countries and many different cultures. You've interacted with people from all over the world with all sorts of backgrounds. And leadership generally is said to be something that is very fluid and adaptable and highly contextual. Mm-hmm. But in all the different contexts and in all the different people and backgrounds and maybe identities that you've dealt with, what are aspects of leadership have been universal? Things that don't change, it doesn't matter what country you're in, mm-hmm. who you're dealing with, and who you're interacting with. Some leadership principles, some leadership approaches that are universal.
Well, thanks a lot, Ben, for that. It's really, as I reflect back on my own leadership journey, it's not something that starts suddenly when you go into a job, right? It's something that you demonstrate or you learn, inculcate from your parents in your whole life journey. So in school, I was the head girl of school. In college, I had a leadership role in different ways, and it comes in a way from that passion to make a difference. Mm-hmm. So when you have a passion to make a difference, it's also about how you try to understand who you're working with and whom the result is going to be for. So for me, some basic principles are to be very clear on what results I'm wanting to achieve as a leader in whatever sphere I'm working on. And those results are very concrete, particularly in my case, in terms of it changes lives of women and children and their families. Mm. It challenges norms that are harmful to them. And it also promotes an opening of thinking and aspiration. So in my journey, it's been important that I understand who I'm working with and the basic principles of respect, dignity, compassion, empathy. These are crucial if I'm to be an effective leader.
Mm. Wow. Now, value-driven leaders lead from and you've mentioned some of it right now, from a deep sense of purpose, mm-hmm. And sort of demonstrated commitment to values like excellence, respect, mm-hmm. Compassion, and the likes. I guess, what are some of the values that you have embraced in your own transformational journey, mm-hmm. That have contributed to the success you've had in leading all the different organizations that you've worked with?
One is the quest to learn. I do not have all the solutions. I have people around me who can give solutions. I, by myself, cannot analyze a problem in its entirety. So it's the humility that this brings, that it's not just me, but it's how I work with my team, with the broader context is so important. So keeping an open mind, not feeling insecure if I don't know the answers, that I need to co-create and discover solutions. I think that for me has been one of my biggest strengths. And I hope I continue to keep the curiosity. I take it, my father, when he was growing up, there weren't any computers, but when he was in his 80s, he decided he needed to learn how to operate a laptop. So we had to buy him a laptop, and imagine even at that age, with his successful career, I saw in him that thirst for learning, the thirst to discover new technologies. And I think that's one of the greatest things that I've needed to do, is to unlearn a lot of my own biases, but to recognize bias. So that's another point. That what are our biases? We all have inherent biases, but how do we understand them and overcome them? Because as a leader, we do need to be able to identify with so many different groups of people, with some people in so many different situations, to try and understand the context they come from, and then together find a solution. So it's really important that we, for me, it has been very important to keep the humility, to keep the curiosity, and also to listen meaningfully, and then really spur action.
And how do you deepen that understanding? Because I think transformational leadership is very collaborative.
Absolutely.
You have to create space for collaboration and for people to engage and collaborate. And you mentioned something, to be able to understand all these groups of people that you're working with. So how do you deepen that understanding where you're not operating from a place of maybe inherent biases that you have about certain groups or certain people, certain attributes of people? So how do you deepen that understanding? And then on top of that, you mentioned something there around insecurity. Because sometimes if you frame your leadership or your position as a position that is supposed to know all the answers, is supposed to give all the answers, then when it comes time to say, I don't know, that's a hard thing to say. So what sort of pillars do you need to build your identity on as a leader to have that sense of deep self-worth and security, where if you don't know the answer, you say, I don't know the answer. If there is somebody who has a better approach, you can create space for them to thrive as well.
And that's really important. So how did I do it, or how would I see it being done? I would say not taking yourself too seriously, right? And that's where understanding yourself is core to it. And I've been privileged that I've worked with leaders, and I've learned from communities to really keep that, to try and understand myself better, why I do what I do, what is important for me, and how important it is to have different people with different skill sets around me if I'm really to drive change. If everyone was thought the same way as I did, life would be pretty boring, right? We need different skill sets. We need people with different views. We need people to challenge us. So I've always been open to being challenged. But it means that I've had to keep an open door. I've had, wherever I go, I ask questions. I show curiosity. I want people to tell me about themselves. One of my biggest learnings was when I first started on my career. I trained as a medical doctor, and I was working with a community-based NGO. And I was given the task to design health education material. So I said, all right, let me find out from women, what is it that they want to learn about? At that time, diarrhea was a big problem in Bangladesh. And on one hand, the traditional approach was starve the diarrhea, no water, no food, let the kid just recover. And we were saying, no, we need to give more fluids, and in the fluids there needs to be a bit of, a pinch of salt and a fistful of molasses, because that will keep the child energized and help the body recover. So I was in this village where there was this woman in a small hut. She could barely even stand in the hut. It was so small. She was pregnant herself, and she was carrying a kid who was probably less than a year old. So I asked her the question. I said, look, have your kids have diarrhea? And when they do, on the one hand, your mother-in-law might be saying to you, don't give your child anything, stop breastfeeding. And I come in and I say to you, no, you have to give more fluids, you have to continue breastfeeding, you have to keep the energy going. Who are you going to listen to? And this woman who has barely been to school, who is in great poverty, she says to me, I'll try what my mother-in-law says, and I'll try what you say, and I'll see what works best for my child. And that was such a lesson in humility for me, that we, at times we tend, especially educated or so-called educated people, we tend to believe that those people who are less educated than us know less, have a less life experience, are less savvy in choices to make. They're not. We have to learn from them. Because if we have solutions that we know work at scale, it's not just telling people, it's how do we convince people. And this is the thing about leadership, I think, not to assume that you have all the solutions, that you know how to drive things, but you have to bring people along. And that collaboration, as you mentioned, without that collaboration, we would not be able to see the types of changes. When COVID hit, 3 simple messages: wear a mask, wash your hands, and stay away from crowded places, right? We saw in countries where there was already the experience of immunization programs, of public health programs, where we had learned how to convince people, there was a faster uptake because people believed in the role they play in public health. Whereas in some countries where they had not needed to have such public health messages, it was more difficult to get people to adopt those behaviors. So that's where, when we look at leadership, it's really important that we look at it from an angle that we need to work with people's way and getting it, and address the disruptors. There will always be disruptors.
And I think in bringing people along, a question that I would like to sort of finalize our conversation with is around diversity of thought. Because I think sometimes when we talk about diversity, having people who are different in the room, that brings with it different ways of thinking. And you mentioned COVID. COVID was a very complex problem that required very divergent thinking to approach it. It's not a problem that has very clear right and wrong answers. And as we can tell in retrospect now, different contexts approached it differently, and we only uncover who was right and who did the right thing as time goes on in terms of the consequences of whatever decisions were made. And so diversity of thought is very critical in creating that space where people can collaborate. And so how can leaders cultivate a psychologically safe environment where people, like you said, from a personal point of view, is to not take yourself too seriously, to become deeply self-aware of your own inherent bias and all of those things. But beyond yourself, how do you create an environment where people feel safe to contribute, where people feel safe to speak their truth, where people can be radically honest in that sense?
In my experience, it's when people see a leader who is authentic, who is honest, who has the humility, they will feel safe in that space. But you also have to, I've had to say that, look, I am trying to create a safe space. And I can demonstrate that if someone has come to me with an issue which is tough, which can challenge my leadership, they have not faced repercussions. And that is so important, that it's not just by talking about it, but it's walking the talk. And by word of mouth, it will it will spread
across the organization. Yeah.
It's about how do I see myself? Do I keep myself aloof? Do I always need to have a schedule where people cannot meet me for the next 5 days? Or is my door open that if you have a crisis, you come to me? If I'm walking, when I was in Juba, I was just walking between 2 rooms outside, and I saw one of my staff, one of my team, she was in the late stages of pregnancy, and she looked very distressed. So I asked her, what is the matter? And she was not feeling well. She needed to be medevaced, and there were problems. There was some hiccup somewhere, and she was getting delayed. So I did step in and help make sure that she was on the flight out to Nairobi, because it was important that the life of, her life and her child's life is saved. So it's walking the talk that is really crucial in creating that safe space. It's about, and I love your bringing in the diversity of thought, because that's very important. And for that, you're looking at in your team, what's the profile? Are there men and women? What about other genders, people who identify differently? Young people. Young people have a different way of thinking. Am I bringing them together? So what I have tried to practice is in our senior leadership teams, having some of our younger team with us. So within our organization, they created space for the young group, young professionals. And having them in our senior meetings and giving them the space to speak, to voice, to contribute, that really helped bring things together. It's about ethnicities. When you're in an international organization, by definition, we have the privilege of having different nationalities from all over the world. But even in my own country, it's people from different regions, different tribes, and different socioeconomic levels, backgrounds. Working in India, do we have representation of all the different castes? Because each one has a different lived experience. We all bring our lived experience to the table, and some of us react differently to our lived experience. And it's how do we bring that together so that we can understand each other and also help others unveil some of the biases, because I go back to that bias issue where we see tensions. It's bias around race, ethnicity, ability, intelligence, and socioeconomic status.
And I think, final question, when we talk about bias and creating a space where people can, sort of unearth the biases that they have, how do we create a space where we're not responding with judgment, but rather it's an opportunity to bring someone along into a new way of thinking so that they can actually learn from where they are to this maybe new, better, ideal place?
No, exactly. And there's so many methodologies. First is, again, I go back to I can't do it by myself. Nowadays, and you probably know it better than me, there are so many organizations that help address these issues. I worked with an organization early in my career who talked about, really how do you bring in transformation of communities. So they were working with caste problems, and they came to our organization and worked with our team to show how we needed to recognize and unlearn some of our biases. Because, say, if we take a simple issue of, and we've heard it in the conference of, what women face during delivery. At times, even women nurses treat women from the poorest segment of society so badly. delivery is not always a nice, joyous experience, but they're told to not shout. They're not treated with respect. They're not treated with dignity. But it's also, in a way, I bring my life experience. If I've been treated badly
because of my socioeconomic
status, I might end up seeing that my power isn't behaving badly. So it's how we define that power in relationships. And if I look at methodology, so it's bringing in agencies or people who have thought about how do you help people recognize their skills. We worked with a theater group who through skits and through getting us involved in issues helped us realize our bias. And there was no judgment in it. It's recognizing what is my bias and how do I overcome that bias for a better program good. Because at the end of the day, if I remain biased, I will be blindsided to the issues that children and women face. The discussion, being open to be challenged. I think that's a way of discovering bias. And the self-reflection, and we do self-reflection in different ways. Some of us, spiritually, we use that time to be self-reflective. I use, my daughters are great at telling me exactly how I'm behaving, how I need to improve, how to keep grounded. So learning from them, being open to learn from them. And I think there are so many great examples, role models around us. And what I do, for me, it's important that I'm there for others to see what is possible. That I come from a humble background. My father was the first literate man in his family, but he went to great heights of professionally achievements. My daughters have done, they will go to different heights than I have achieved. But it's really about how do we provide that opening for others to move. And I think that WomenLift Health, that lift is an important one. And it's not lift but with just money and status. It's really about lifting with confidence, instilling compassion, and helping women discover their best way of being a woman and a leader. And that's crucial.
Wow. What a way to close the conversation. Thank you so much, Dr. Yasmin, for the time and for your wisdom. You have inspired me, and I'm sure you've inspired our viewers and those who are listening to this episode. And to our dear listener and viewer, we have come to the end of our conversation. This has been the WomenLift Podcast. I am your host, Ben Oden.
Thank you so much, Ben.